There really are three main choices of treatment, and that would be metal self-ligating brackets, sometimes referred to as Damon braces. That's just one company that makes that particular type of bracket that has a door mechanism on it. They're metal and they look like this, and they're awesome because you can still put colors on them if you want to. Usually the colors are for a reward because the door that's on the bracket itself pretty much eliminates the need for that rubber donut anymore. But with these amazing brackets, these high technology brackets, we have the ability to create changes that we didn't have the ability to create before. The ability to gradually widen arches in the presence of crowding without flaring teeth. The ability to create big movements with rubber band wear that used to be somewhat challenging and laborious to accomplish. Essentially, silver brackets with doors on them called self-ligating braces, Damon braces being probably the most popular version out there. An upgrade or an improvement on the Damon bracket system is called the H4 bracket system. And I've personally been involved in beta testing and using that particular upgrade to the Damon bracket system. And that's our current choice for traditional, or I should say, metal brackets on teeth. Now, the clear version of that bracket is also available on the upper teeth. Usually the upper 8 teeth can receive clear brackets to balance that out, and it's available at no extra cost. So Invisalign is a series of clear plastic aligners that are created with three-dimensional virtual technology and software, as well as 3D printing. Creates the model whereby these plastic trays are created. And it's a series of them, it's not just one. And each of those are worn anywhere from as little as 3 days up to 14 days, depending upon the treatment need and whether the patient chooses to accelerate their treatment or not. Patients often have these little bumps on their teeth called Invisalign attachments. They're almost completely invisible, but not all the way. And that gives a handle for the aligner to grab hold of it and create movement. So really, those are our choices. Beyond that, some patients need treatment at earlier, younger ages. That would be considered early treatment, sometimes at the age of as early as 7. There's a need for some sort of treatment for them. But all patients age 7 or older are encouraged to seek consultation so their needs can be assessed, and then from there, treatment rendered. Early treatment then involves usually upper and lower braces for a period of only 12 months, where we get in and solve big crowding problems, big jaw discrepancy issues, or habits like thumb sucking. And then we get out of treatment and we take a break until the age of, say, 13, 14, or 15, and then we do a second phase of treatment down the road to complete the outcome the way we want it to be in its final status. Limited treatment is usually just a touch-up. Say a few things have moved and changed, you wore your retainer and it got lost, or your bonded wire retainer came off and it broke. We sometimes will recommend a series of clear brackets only on a segment of teeth, just to align and refine what used to be perfect. And sometimes that's a better and easier alternative than having to wear aligners in your mouth. So there's really 5 categories of treatment. There are metal, Damon self-ligating brackets, H4 brackets that allow us to align teeth efficiently. There are clear self-ligating brackets that are the aesthetic alternative to the metal. There are aligners using the Invisalign system, a series of clear plastic trays created with virtual software. Or there are limited clear bracket situations where we place brackets on a segment in the upper or the lower arch or individual areas to touch up or refine relapse that's occurred.